I remember the first time I saw someone suffering from schizophrenia when I was a medical student. I still think about them and their families and what effect the illness had on them. As I learned more about it, as I did more reading, I realized that we knew very little. And I saw that as a very important challenge. I've really devoted my effort to trying to see if we can do a better job of treating these conditions. Schizophrenia is a brain disease. It affects about 1 out of every 100 people around the world. And it affects their ability to think clearly and logically. They may experience delusions, which are fixed false beliefs, hallucinations, hearing a voice when there's no one around. It can also influence motivation and behavior in a variety of ways. These symptoms, which can interfere with their ability to function, and it can be quite devastating. And it is an illness that we can treat, but we can't cure. The important thing is to recognize the illness, to get treatment as early as possible. In the United States right now, the average duration of untreated psychosis is about a year or more. So that means people are in the community experiencing these difficulties, but not getting any treatment. If we can help educate people as to what to look for in terms of early signs and symptoms of mental illness, that can help get people into treatment more rapidly. And our sense is that if we can do that, we have a better chance of keeping the illness under control. So RAISE is a program that was established by the National Institute of Mental Health. It stands for Recovery After an Initial Schizophrenia Episode. The idea was to see if by treating the illness early with what we call a comprehensive care program, and that means integrating medication and psychosocial treatments, could we improve the outcome? So what we did was to work with 34 community clinics in 21 different states. We ended up involving 404 first episode patients, and we followed them for 2 years. And we found that the comprehensive care intervention was successful in improving their quality of life and increasing their likelihood of working or going to school, and helped change the course of this illness. And so we are continuing to collaborate with some of those sites, and we believe that they have an enormous amount to contribute to future research. Social media provides a tremendous opportunity for us to also help people to understand what signs might appear on social media that could be cause for concern. What we're trying to do is work with other investigators to develop algorithms that could help us analyze the use of language and words in different ways to be able to detect the early signs of mental illness. In addition, we've been working with smartphones using apps that can help patients recognize signs and symptoms, developing more real-time monitoring of patients' illness, reminders to take medication, brief cognitive behavior therapy to help patients deal with some of the problems they may be facing. Brain imaging has been a very, very helpful tool in understanding the pathophysiology of schizophrenia, and I think helping to convince everyone that in fact schizophrenia is a brain disease. And so what some of our young investigators have found is that differences in this functional connectivity can actually predict response to antipsychotic medication. And our hope is that some of this new research will set a precedent in that regard, that we will be able to use some of these findings in actually making decisions about which medication is most appropriate for that individual. I think it's important for people to understand that when we talk about learning more about a particular illness, we have to enlist the cooperation of those patients who are suffering from that illness to work with us. And that's the only way that we can improve treatments, change outcomes, prevent and cure illnesses. It all depends on research. In our health system, the Feinstein Institute plays a very important role in bringing investigators from different disciplines together so they can collaborate. We want to approach these illnesses from the standpoint of genetics, brain imaging, neuropsychology, neurophysiology. So you need a team, or as they say, you need a village. And the Feinstein provides that village.